Assalamu alaikum. My name is Nimra Zahid from MS Chemistry, roll number 210011140017. Today I am going to present my topic, that is cancer. First of all, we see what is cancer. Cancer refers to the cells that grow out of control and invade other tissues. Cells may become cancerous due to the accumulation of defects or mutations in their DNA. Certain inherited genetic defects and infections can increase the risk of cancer. Environmental factors, including air pollution, poor lifestyle choices such as smoking and heavy alcohol use, can also damage DNA and lead to cancers. Cancer is the uncontrolled growth of abnormal cells anywhere in a body. There are over 200 types of cancers. Anything that may cause a normal body cell to develop abnormally potential can cause cancer. General categories of cancer-related or causative agents are as chemical or toxic compound exposures, ionizing radiations, some pathogens, and human genetics. First of all, we see the difference between benign and malignant tumors. Benign tumors grow locally and do not spread. As a result, benign tumors are not spread. As a result, benign tumors are not considered cancer. They can still be dangerous, especially if they press against vital organs like the brain. Malignant tumors have the ability to spread and invade other tissues. This process, known as metastasis, is a key feature of cancer. There are many different types of malignancy based on where a cancer tumor originates. Benign versus malignant tumors. Benign, not cancer tumor cells grow only locally and cannot spread by invasion or metastasis. As shown in the figure, these are the normal cells and these are the benign cells. Malignant tumor cells invade neighboring tissues. As you can see, these are the normal cells, and malignant tumors enter the blood vessels and metastasize to different sites. What is cancer metastasis? Metastasis is the process by cancer cells break free from a malignant tumor and travel to invade other tissues in the body. Cancer cells from the original or primary tumor can travel to other sites such as the lungs, bones, liver, brain, and other areas. These metastatic tumors are secondary cancers because they arise from the primary tumor. What is metastasized cancer? Metastasized cancer. Metastatic cancers retains the name of the primary cancers. For example, bladder cancer that metastasizes to the liver is not the liver cancer. It is called the metastatic bladder cancer. Metastasis is significant as it helps to determine the staging, the treatment, and some types of metastatic cancers are curable, but many are not. We see what causes cancers. Certain genes control the life cycle, the growth, function, division, and death of a cell. When these genes are damaged, the balance between normal cell growth and death is lost. Cancer cells are caused by DNA damage and out of control cell growth. As you can see in the bar chart, estimated percentage of cancer cases caused by identifiable and or potentially preventable factors. Tobacco causes 33%, excess weight and obesity 20%, diet 5%, lack of exercise 5%, occupation 5%, viruses 5%, family history 5%, uses of alcohols 3%, UV and ionizing radiation 2%, prescription drugs 1%, reproductive factors 3%, pollution 2%, and at last, the reason which is unknown causes the cancer around 11%. The next slides include a partial list of factors known to damage DNA and increases the risk of cancer. First, what is mutations cause? Genetic mutations may cause cancer. For example, mutations of genes increase the risk of cancers. They inhibit the body's ability to safeguard and repair the DNA. Copies of these mutated genes can be passed on genetically to future generations, leading to a genetically inherited increased risk of cancer. Then some of the causes, environmental cause that may lead to cancer, microbes cause, lifestyle and diet cause. We see one by one. First, starting from the environmental cause, Cancer may be caused by environmental exposure. Sunlight can all cause cancer through ultraviolet radiations. What is microbes cause? Some microbes are known to increase cancer risk. They include bacteria like H. pylori, which causes stomach ulcers and has been linked to gastric cancer. Viral infections have also been linked to cancer. Lifestyle and diet causes. Lifestyle choices can lead to cancer as well, including eating a poor diet, inactivity, obesity, heavy alcohol use, tobacco use, including smoking, and exposure to chemicals and toxins that are all associated with greater risks, cancer risk. What are the common cause cancer symptoms and signs? Common cancer symptoms are fever, pain, fatigue, skin changes, redness, sores that won't heal, jaundice, darkening, unintended weight loss or weight gain. Other more obvious signs of cancers may include lumps or tumors, that, that is mass, and difficulty swallowing, changes or difficulties with bowel or bladder function, persistent cough or hoarseness, short of breath, chest pain, unexplained bleedings or discharge. 7 common cancers, including cancer, is the second leading cause of death in the United States. The most common cancers diagnosed in the US are those of the prostate cancers, lung cancers, colon cancers, rectum cancers, bladder cancers. Cancers of the lung, colon, and rectum, breast, and pancreas are responsible for the most deaths. The prognosis of different cancers is highly variable. Many cancers are curable with early detection and treatment. Cancers that are aggressive or diagnosed at a later stage may be more difficult to treat and can even be life-threatening. Estimated cancer rates in the US in 2013, men 306,920, in women 273,430. Lungs and bronchus 28% in men and 26% in women. Prostate cancer is 10% in men and breast cancer is 14% in humans. Colon and rectum cancers in 9% in men and 9% in women. Pancreas in 6% in men and 7% in women. Liver 5% in men and ovary cancer in women is 5%. What are the stages of cancer? The TNM classification of a cancer usually correlates to one of the following 5 stages. Stage 0. This refers to the cancer that is in situ, meaning that cancerous cells are confined to their site of origin. This type of cancer has not spread and is not invading other tissues. Stage 1 to stage 3, including higher stages of cancer, correspond to larger tumors and or greater extent of disease. Cancers in these stages may have spread beyond the site of origin to invade regional lymph nodes, tissues, or organs. Stage 4. This type of cancer has spread to distant lymph nodes, tissues, or organs in the body far away from the site of origin. Stages of cancer. Stage 0 is carcinoma in situ early form. Stage 1 is localized form. Stage 2 is early locally advanced form. Stage 3 is late locally advanced. And stage 4 is metastasized. Diagnosing cancer. How we diagnose that cancer occur or cause how we diagnose cancers in human body. Various tests may be performed in order to confirm a cancer diagnosis. Positron emission tomography and computed tomography PET, CT scans, and other similar tests can highlight hotspots of cancer cells with high metabolic rates. The most common tests and procedures used to diagnose cancers include mammogram, Pap test, tumor marker test, bone scan, MRI, tissue biopsy, PET, CT scan. What are the cancer symptoms and signs? Symptoms and signs of cancers depend on the type of cancer, where it is located, and or where the cancer cells have spread. The American Cancer Society describes 7 warning signs and symptoms that cancer may be present and which should prompt a person to seek medical attention. The word caution can help you remember these. Change in bowel or bladder habits, a sore throat that does not heal, thickening or lump in the breast, testicles, or elsewhere, ingestion usually chronic or difficulty in swallowing, obvious change in the size, color, shape, or thickness of a wart or mole, nagging cough or hoarseness. Other signs or symptoms may also alert you or your doctor to the possibility of your having a form of cancer. These include the following: unexplained loss of weight or loss of appetite, a new type of pain in the bones or other parts of the body that may be steadily worsening or come and go, but is unlike previous pains one has had before, persistent fatigue, nausea, or vomiting. Unexplained low-grade fevers may be either persistent or come and go, recurring infections which will not clear with usual treatment. Specificity of type of cancer. Many cancers will present with some of the above general symptoms, but often have one or more symptoms that are more specific for the cancer type. For example, if we take lung cancer, that lung cancer may present with common symptoms of pain, but usually the pain is located in the chest. The patient may have unusual bleeding, but the bleeding usually occurs when the patient coughs. Lung cancer patients often become short of breath and then become very fatigued. What are the different types of cancers? 6 types of cancers. Cancers can occur anywhere in the body. Broadly, cancers are classified as either solid, which includes lung or prostate cancer, liquid blood cancers, and cancer is further classified according to the tissue in which it varies. What is carcinoma? Carcinomas are the cancers that occur in epithelial tissues in the body. They comprise 80% to 90% of all the cancers. Most lung, colon, skin, and prostate cancers are carcinomas. This class includes the two most common skin cancers, basal cell carcinoma and squamous cell carcinoma. What is sarcoma cancer? Sarcomas occur in connective tissue like the bones, cartilage, fat, blood vessels, and muscles. This class of cancers include bone cancers, osteosarcoma, Ewing sarcoma, Kaposi sarcoma, which causes skin lesions, muscle cancers, and leiomyosarcoma. What is myeloma cancer? Myelomas are cancers that occur in the plasma cells in the bone marrow. This class of cancers include multiple myeloma, also known as Carl disease. Leukemia. Cancer that starts in the blood-forming tissue, such as the bone marrow, and causes larger numbers of abnormal blood vessels to be produced and enter the blood. Leukemia, lymphoblastic leukemias, ALL and CLL, myelogenous leukemias, AML, CML, T-cell leukemia, and hairy cell leukemia. This leukemia is included in the liquid cancers. What is lymphoma cancer? Lymphomas are the cancers of the immune system cells. These include the rare but serious Hodgkin lymphoma, Hodgkin's lymphoma, also Hodgkin's disease, and a large group of white blood cell cancers known collectively as non-Hodgkin lymphoma, non-Hodgkin's lymphoma. What is lung cancer? Lung cancer occurs when cells divide in the lungs uncontrollably. This causes tumors to grow. These can reduce a person's ability to breathe and spread to other parts of the body. Lung cancer is the third most common cancer and the main cause of cancer-related death in the United States. What is a colorectal cancer? Colorectal cancer is a disease in which cells in the colon or rectum grow out of control. Sometimes it is called colon cancer. The colon is the large intestine or a large bowel. As you have seen, a lump of cancerous cells in the colon of a human being. What is the liver cancer? Primary liver cancer is a malignant tumor that begins in the liver. There are different types. First one is hepatocellular carcinoma or hepatoma is the most common type of primary liver cancer, and it starts in the main cell type in the liver, the hepatocytes. Second type is cholangiocarcinoma or bile duct cancer. It starts in the cells lining the bile ducts, which connects the liver to the bowel and gallbladder. Angiosarcoma, which starts in the blood vessels. This is a rare type of liver cancers that is more likely to occur in people over 70. What is pancreatic cancer? Pancreatic cancer is the cancer that forms in the cells of the pancreas. Pancreatic cancer begins in the tissues of your pancreas. Pancreas are an organs in your abdomen that lies behind the lower part of your stomach. Your pancreas releases enzymes that aid digestion and produces hormones that help manage your blood sugar. There is a difference between healthy pancreas and pancreatic cancer. Yet you can see the cancerous cells are around to grow in the pancreas. What is central nervous system cancers? Cancers that begin in the tissues of the brain and spinal cord, tumors, gliomas, pituitary adenomas, vestibular schwannomas, primary central nervous system lymphomas, and primitive neuroectodermal tumors. What specialists treat cancer? A doctor who specializes in the treatment of cancer is called an oncologist. He or she may be a surgeon, a specialist in radiation therapy, or medical oncologist. They first use surgery to treat the cancer. The second, they use radiation therapy. And the third, they use chemotherapy and related treatments. Each may consult with the others to develop a treatment plan for the particular patient. In addition, other specialists may also be involved depending upon where the cancer is located. For example, OB-GYN specialists may be involved with uterine cancers. Immunologists may be involved in the treatment of cancers that occur in the immune system. How do physicians determine cancer staging? There are a number of different staging methods used for cancers, and the specific staging criteria varies among cancer types. Site of the primary tumor, tumor size and number of tumors, lymph node involvement, spread of cancer into lymph nodes, cell type, and tumor grade, how closely the cancer cells resemble normal tissue cells, and last, the presence or absence of metastasis. What is TNM system? The TNM system is based on extent of the tumor, the extent of spread to the lymph nodes, and the presence of the distant metastasis. A number is added to each letter to indicate the size or extent of the primary tumor, and the extent of the cancer spread. Higher number means bigger tumor or more spread. What is TNM staging system? Primary tumor. TX primary tumor cannot be evaluated. T0, T0, no evidence of primary tumor. TIS, carcinoma in situ, abnormal cells are present but have not spread to neighboring tissues, although not cancers. CIS may become cancer and is sometimes called pre-invasive cancers. T1, T2, T3, and T4 size and or extent of the primary tumor. Second, regional lymph nodes, that is denoted the N of the TNM system. NX, regional lymph nodes that cannot be evaluated. N0, no regional lymph node involvement. N1, N2, and N3 is the involvement of regional lymph nodes, number of lymph nodes, and extent of the spread. Distant metastasis, that is the M of the TNM system, last part. MX is the distant metastasis that cannot be evaluated. Some clinicians do not ever use this designation. M0, no distant metastasis, and M1 is the distant metastasis is present. Here is the stages and definitions. Stage 0 includes the carcinoma in situ. Stage 1, Stage 2, Stage 3 includes higher numbers indicate more extensive disease, larger tumor size, and a spread of the cancer beyond the organ in which it first developed to nearby lymph node and organs adjacent to the location of the primary tumor. And stage 4 is the cancer that has spread to another organs, and it is the last stage of every type of cancer. What is SEER? Cancer registries use surveillance, epidemiology, and end results program. Termed summary staging, SEER groups cancer cases into 5 main categories. In situ, abnormal cells are present only in the layer of cells in which they develop. Localized, cancer is limited to the organ in which it began without evidence of the spread. Regional cancer has spread beyond the primary site to nearby lymph nodes or organs and tissues. Distant, cancers has spread from the primary site to distant organs or distant lymph nodes. Unknown, there is not enough information to determine the stage. Here is the cancer type, estimated new cases, and estimated deaths. What are the risk factors and causes of cancers? Chemicals or toxic compounds exposures. Benzene, asbestos, nickel, cadmium, vinyl chloride, benzidine, and nitrosamines. Tobacco or cigarette smoke contains at least 66 known potential carcinogenic chemicals and toxins. asbestos, and aflatoxin, which may cause cancers. Ionizing radiations, including uranium radon, ultraviolet rays from sunlight, radiation from alpha, beta, and gamma, and X-ray emitting sources may cause different types of cancers. Here you can see that radiations come to the cell of the body, they disturb the DNA, cause mutations in the DNA, and cancer cells are formed, then they grow and tumor is caused. What are the pathogens? HBV, HCV, HPV, and H. pylori account for approximately 5% of all the cancer cases by leading to the hepatocellular carcinoma, cervical cancer, and stomach cancer, respectively. Pathogens can generally be divided into direct and indirect carcinogens. Genetics. What causes the genetic changes, and then genetic changes causes cancers. The most commonly mutated gene in people with cancer is P53 or TP53. More than 50% of the cancers involve a missing or damaged P53 gene. Most P53 gene mutations are acquired. Germline P53 mutations are rare, but patients who carry them are at high risk of developing many different types of cancers. A number of specific cancers have been linked to human genes as breast, ovarian, colorectal, prostate, skin, melanoma. Is there a cure for cancer? Until a cure can be found, prevention through a healthy lifestyle is the best way to stop cancer. Some ways to help protect yourself from the cancers include eating plenty of fruits and vegetables, maintaining a healthy weight, abstaining from tobacco, drinking only in moderation, exercising, avoiding sun damage, getting immunizations, and getting regular health screenings. What is surgery? Surgery is often performed to remove malignant tumors. Surgery allows for the determination of the exact size of the tumor as well as the extent of the spread and invasion into other nearby structures or lymph nodes, all important factors in prognosis and treatment. Surgery is often combined with other cancer treatments such as chemotherapy and radiations. Sometimes cancers cannot be entirely surgically removed because doing so would damage critical organs or tissues. In this case, debulking surgery is performed to remove as much of the tumor as is safely possible. Similarly, palliative surgery is performed in the cases of advanced cancer to reduce the effects, for example, pain or discomfort of a cancerous tumor. Debulking and palliative surgeries are not curative, but they seek to minimize the effects of the cancer. What is radiation therapy? Radiation is a very common cancer treatment. About 50% of all the cancer patients will receive radiation treatment, which may be delivered during, or after surgery and or chemotherapy. Radiations can be delivered externally where X-rays, gamma rays, or other high-energy particles are delivered to the affected area from outside the body, or it can be delivered internally. Internal radiation therapy involves the placement of the radioactive material inside the body near cancer cells. This is called brachytherapy. Systemic radiation involves the administration of radioactive medication by mouth or intravenously. The radioactive materials travel directly to the cancerous tissues. Radioactive iodine 131 is used for thyroid cancer. Strontium 89 is used for bone cancer are the two examples of systemic radiation treatments. Typically, external radiation is delivered 5 days a week over the course of 5 to 8 weeks. Other treatment regimens are sometimes used. What is chemotherapy procedure? Chemotherapy is most often given as an infusion into a vein intravenously. The drugs can be given by inserting a tube with a needle into a vein in your arm or into a device in a vein in your chest. Chemotherapy pills. Some chemotherapy drugs can be taken in pill or capsule form. If eliminating all cancer cells is not possible, the goals of the treatments may be to slow the growth of the cancer, keeping the cancer from spreading, and relieve cancer-associated symptoms such as pain. Depending on the type of the chemotherapy prescribed, the medications may be given by mouth, injection, intravenously, or topically. Chemotherapy may be delivered via catheter or port, which is usually implanted in a blood vessel of the chest for the duration of the therapy. Sometimes chemotherapy is delivered regionally directly to the areas that needs treatment. For example, intravesical therapy is used to infuse chemotherapy directly into the bladder for the treatment of bladder cancer. Other treatments, in addition to surgery, radiation, and chemotherapy, other therapies are also used to treat cancer. First one is targeted or biological therapies. Targeted or biological therapies seek to treat cancer and boost the body's immune system while minimizing damage to normal healthy cells. Targeted therapy, also called biological therapy, is the name given to a group of drugs that block the growth and spread of cancer. They target and interfere with the processes in the cells that help cancers grow. Monoclonal antibodies, immunomodulating drugs, vaccines, and cytokines are examples of the targeted or biological therapies. Hematopoietic stem cells transplants. Hematopoietic stem cells transplants involves the infusion of stem cells into cancer patients after the bone marrow has been destroyed by high-dose chemo or radiation. Angiogenesis inhibitors are cryosurgery. Angiogenesis inhibitors are the medications that inhibit the growth of new blood vessels that cancer's tumors need in to grow. Cryosurgery involves the application of extreme cold to kill precancerous and cancerous cells. Photodynamic therapy. Persons with cancer cells receives a drug called a photosensitizer in 24 to 72 hours. Cancer cells absorb the photosensitizer. Cancer cells that absorb the photosensitizers are exposed to light. Light causes the photosensitizers to make a form of oxygen that kills the cancer cell. This is all the procedures of the photodynamic therapy. Conclusion. The concluding remarks of my presentation is a plan for the diagnosis and treatment of cancer is a key component of any overall cancer control plan. Its main goal is to cure cancer patients for prolong their life considerably, ensuring a good quality of life. In order for a diagnosis and treatment program to be effective, it must never be developed in isolation. That's all from my side. Thank you so much.